Well, basically what we do as part of the procedure is if you have had any prior medical history in the scrotal area, what we would ask you to do is part of the procedure is before you come for your operation, you'll be observed by one of our surgeons and you'll be told at the time that it will be an assess and op. If once our surgeons assess you and they've said that you're okay to actually have the op, then that's fine, you'll go through. But if when you do come to us and we find that we can't do the operation because of some prior surgery in that particular area, or because it's actually difficult and therefore it would be better for you to undergo it under general anaesthetic, then obviously we'll have that discussion with you at the time, and then if we need to get to send you to have a general anaesthetic, we will refer you back to your GP and tell them what plan you need to follow. Age doesn't matter. If you're producing sperm, then this operation can be done at any age. However, we would advise that youngsters who are under the age of 25 do not really consider this operation until they are after 25. We don't operate on anybody below 25 because what we want to do is make sure that a patient has considered all their options, and until they're over the age of 25, they really can't make that decision as to whether they want children or not. What happens there is our team will give you a call. First of all, for the first 10 minutes, you'll be speaking to one of the clinical administrators. The clinical administrator will go through with you what you need to do to get ready for the operation. They'll go through your pre-operation sheet that they will have sent you with your appointment letter for your counselling. They'll discuss with you about how you should prepare, as in shaving, what you should be using for shaving, whether you should eat something before you actually come to the operation, or they'll discuss with you about pain relief. They'll discuss with you the fact that you shouldn't be driving post-op, the fact that you should have a shower or a bath on the day of your operation. And you'll then speak to one of the counsellors who'll go through with you what actually happens during the operation, as in they'll discuss with you that there's an incision. They'll discuss with you that the vas deferens or tubes are pulled through that incision. They are cut, then they are put back, or they can be tied off and then they're put back, and that's basically the operation itself. And then basically you are left with an incision that basically heals. If you do require to have stitches, you will have stitches, but if you don't, if the operation area can actually heal by itself, because it's only a small cut incision, they will allow you to do that. And then basically they'll discuss with you then about the semen testing that needs to be done so that we can check that the operation's been a success, which is 16 weeks post-op, and that's what is discussed during the counselling session. When you arrive, you'll be seen by a clinical administrator, which is myself or one of my colleagues, who will go through the semen testing procedure with you, and they'll tell you how you do it, how often you need to do the ejaculations, and also go through some of that detail with you. Then you'll go into the operating room where you will actually have your operation with one of our surgeons, which will take approximately 10 to 15 minutes, and then you'll go into recovery, which will be for half an hour to 3/4 of an hour. Once you are okay and you're allowed to leave, nurses will go through the post-operative information with you, and then normally, if everything is all right, then you'll be allowed to be discharged. Yes, the operation does hurt. It's an operation. So most of our gentlemen say the most uncomfortable part of the operation is actually the needles. Once that's done though, that's the lidocaine going in, which is the anaesthetic. After that, most of our gentlemen say then that the operation is pretty swift. It takes 10 minutes for the operation, most operations to happen. And then after that, we'll have anaesthetic, which will stay in your system for about 1 to 2 hours. Obviously, once the anaesthetic does start wearing away, then you obviously will need pain relief, which is why we say during our counselling session for you to bring pain relief with you. But at some of our sites, there are pharmacies not far by where you can actually buy some, but paracetamol and ibuprofen do the job. Vasectomy is a very good method of contraception. It doesn't affect any hormones, plus the male sterilisation is a shorter operation, it's less invasive than the female sterilisation process, and it doesn't mess with a man's hormones, whereas the female sterilisation does mess with the lady's hormones and obviously then causes early onset menopause.